You guys are probably like, what the fuck did she just say? Obviously I have to speak gibberish because y'all genuinely do not listen to anything that I say.
Fat dissolving lipo shots on my client.
Watch me do needless fat dissolver.
Everybody, I am the Mademoiselle and this is my channel. Welcome to part 2 of the basement BBL panoramic. Okay, y'all already know the algorithm's still a little bit sensitive to the word pandemic, so I gotta say panoramic. If you guys did not see my first video talk about basement BBLs, make sure you guys do so. In that video, I talked about how people are injecting fat dissolvers with Hyaluron pens, and we were gonna do a part 2 because y'all, I just cannot believe this shit. Like, y'all, it's like pas parler anglais. Like, I don't speak English. Now I understand I speak some Creole here and there because, you know, I'm Haitian. You know, I gotta infuse the little Creole for y'all. But like, do y'all not hear anything I say? Like, I understand y'all don't gotta listen and do as I say, but like, god damn it. Like, are we not learning anything? Like, I need to literally start keeping a list of all of these texts and whatever the case may be. In the mass. Like, doing this one by one is literally not helping. Like, I need to, oh my god, who's blowing up my phone? Is it important? No, leave me alone. Because it's getting to a point where I just can't, like, my head is really starting to hurt. Like, we're never going to run out of things to talk about here. So like I said, today we're going to be talking about people using Hyaluron pens to inject fat dissolvers.
Lipo fat dissolving injections.
So here in this video, I am using PCDC, also known as our liquid lipo, to dissolve unwanted fat on the lower abdomen. PCDC is similar to Kybella, but Kybella is solely deoxycholic acid. PCDC is phosphatidylcholine in conjunction with deoxycholic acid. By adding this extra ingredient, we are able to do several things. We are able to aid that fat dissolving, make it happen a lot faster, and it also takes out that horrible burn that you have when you're injected with Kybella. As you can see, this patient is talking, smiling. The procedure is completely comfortable.
Lipo-Dissolve is easily becoming one of my favorite procedures. You see real results, like inches shrunk in at least 3 to 4 weeks.
So at the end of last month, the FDA put out a warning because they've got repeated complaints of people with adverse reactions when they had fat dissolving injections that weren't FDA approved at med spas all around the country. So some of the names of these fat dissolvers are Aqualix, LipoDissolve, LipoLab, Cabeline, and then there's another one called Lemon Bottle that you'll see all over TikTok. Now, some of these are approved in other countries around the world, and they have gone through testing there, but they haven't gone through testing in the United States. And then Lemon Bottle has not apparently gone through testing anywhere. So in the United States, we have one fat dissolver that is FDA approved, and it's called Kybella. It's deoxycholic acid, and so it's a bile acid that helps dissolve fat. These other non-FDA approved ones are similar. Lemon Bottle is different. So Lemon Bottle has vitamin B2, bromelain, as well as lecithin. And the way these compounds work is you inject them under the skin, they dissolve fat in the immediate area, and then the fat is reabsorbed by your body. These products are great for small areas of fat reduction, for spot reduction. They're not great for big areas. So the key to using fat injections properly is injecting them properly. And so you want to have a standard concentration, a standard injection amount, you want it at a certain depth, and you want your injection points a certain distance apart from each other. And that's how you avoid complications and get a nice even reduction. So a big problem with these non-FDA approved, which frankly illegal injections, is that they're being done by not medical professionals, or certainly unethical, not properly trained medical professionals. So they're injecting them too far apart, too much, and you're developing a lot of these complications: skin damage, knots of fat necrosis and cysts, as well as lumpy, bumpy contour deformities. So at the bottom here, they have a photo of a patient who had these illegal injections, and she developed an atypical mycobacterial infection. They've had reports of that as well. And this is a very difficult bacteria to treat when you see infections like this. It can take many, many months of antibiotics and have a lot of scarring and deformity. So here's a close-up picture of this patient's arm, and as you can see, those injection points, to be frank, aren't even properly spaced, and she's going to have permanent scarring and likely deformity in that area after her many, many months of antibiotic treatment, which is also likely quite expensive. Like I said, people are also using the Hyaluron pen to inject this, and this is also a very bad plan. So first of all, the Hyaluron pen, again, is not FDA approved. And so using that device, you are not getting a consistent depth and amount with your injection site. So it's going to be much more likely, in my opinion, to lead to an irregular contour. So as a patient, if you're considering any type of fat dissolving injections, the first thing is you want to go to a facility that is run and overseen by a board certified plastic surgeon or a dermatologist. These are the only two structured recognized training programs in the United States that include aesthetic treatments. And I think this is very important. You also want to make sure that the person who is injecting you, who works at that facility, has proper training and licensure in your state. So nurses, nurse practitioners, PAs, physicians, you want to make sure that they've done the proper training and they have the proper licensure. And that's to prevent infection and problems like you see in that photo, because those mycobacterial infections are almost always because of improper sterile technique. And then finally, only go to facilities that are using approved injectables for your country. In the United States, that's by the FDA. Any company that's willing to break the law to make money off of you is no friend of yours, and they are not considering your safety. You should run screaming. So if you see any of this going on in your community, please report the practitioners in the facility to your state medical board and nursing board. And then you also want to report it to the FDA. So especially if you've had a adverse reaction from any of these substances. So fat injections are an amazing option for patients for spot treatment, but it is so important you go someplace that's operating ethically. Please don't put your life at risk.
Like I said, please watch my other videos to be caught up on the whole illegal injection services. But apparently there's people injecting all types of crazy things into people without any licenses. And now it's becoming extremely popular for people to use the Hyaluron pen to inject all types of caca into people, specifically for dissolving fat, because now, as we all know, the BBLs are becoming a problem for a lot of women, because now the BBLs are too big. A lot of people are now understanding that they should have never did them in the first place. They did them too early. They need revision, all types of things.
People are injecting this Hyaluron pen into their lips, and the results are bumpy, lumpy, uneven lips. And what's crazy is that you can't reverse it, because you don't know what's in it.
And this is why you guys need to stop getting those needless lip fillers by people who are not injectors. Look at the difference between how it's placed. Those needless lip fillers are forcing the fluid through your lips versus being injected. You'll notice that these needless lip fillers are not done by any sort of trained injector. The minimum qualification for someone to be able to inject anything into your face is a RN, a registered nurse. Estheticians, we don't even do fillers. We're not trained in that. So why are you going to someone who got a certificate and getting these fake lip fillers where they're where an uncontrolled amount of hyaluronic acid is being forced through the tissue, and in some extreme cases, it can cause the skin to die. So think about that before you want to find a dupe for lip fillers, instead of just investing in going to a trained professional who is insured in case something bad happens.
What is up, you guys? My name is Nurse Viv, and I'm an aesthetic nurse injector. This is one of the big reasons I do not like the Hyaluron pen. There is absolutely no precision when injecting the filler, and you could cause vascular occlusions, infections, and skin abscesses. Placing the filler with a needle is a lot more precise, and you're at less risk for causing a vascular occlusion. Hyaluron pens are not FDA approved and not used by medical professionals. Stop using the Hyaluron pen.
Hyaluron pen, it's not what it seems to be on the internet. It is dangerous.
Now people are resorting to different types of fat dissolvers in order to get these BBLs corrected, instead of going under the knife to get these corrected again. Now, what's very interesting is a lot of these illegal injectors and technicians are advertising these services as surgery-less BBL reversal, or just fat dissolver, or dissolve your your fat without going under surgery. It's very interesting and it's very weird. And there's a few different ways that you can go about getting fat dissolvers depending on what country you are in.
The Kardashians have done it again, talking about reverse BBL. So there's only 2 ways to reverse a BBL or remove any fat from your body. Deoxycholic acid, also known as Kybella, or liposuction if you have the time to do it. This, anywhere where I can pinch your fat, again, just around your buttocks, around your hips, and that banana roll, around your belly, the bra fat. So if you want to reverse a BBL or remove any fat, deoxycholic acid is the way to go if you don't want the downtime.
Hey guys, Dr. Angela here with Surgical Arts and Aesthetics. Let's talk about this one today. For those who don't know, I am triple board certified surgeon and I have plastic and cosmetic and weight loss surgery in my practice. This is something we don't do, but we need to talk about. So fat dissolving injections, what are they? So most commonly we hear about similar procedure that actually is FDA approved under the name of Kybella or deoxycholic acid. Deoxycholic acid is something very similar that our body makes to break down our own fat that we eat in our GI tract, our gut, right? But this is different. Usually Kybella is too expensive to do it on a larger scale. Kybella is only approved for the under the chin. However, people started adding it in non-surgical practices, usually non-medical or small spas, to kind of try to offer fat melting instead of offering liposuction, which doctors could, to melt some fat in jowls, to melt some fat in armpit fat, different areas. But then it started getting bigger and people started offering it for larger parts of the body, like the whole abdomen or all of your flanks. And the fact is you'll need to inject a lot of that acid underneath the skin to get any kind of visible result. So in order to melt all that fat, that means people have to come back for multiple sessions of the injection of this acid. There's multiple variation of that. Some of this can be compounded deoxycholic acid. Some of that could be like other similar type of acids that are not FDA approved for this kind of use. So then what happens? People go and they get some fat dissolved. Remember, fat does not heal. Fat melts and scars and necrosis. Necrosis means this kind of just dies off and just falls apart and then forms like a fatty cyst. Well, if you do it all over your whole abdomen, for example, now that whole area is full of cysts, and then the skin above it starts to get discoloration. It's especially going to be noticeable in somebody with darker skin, so African-American skin, black skin, right? Brown skin. You will see way more of that discoloration and unevenness because of the way the fat melts and scars and discolors. So FDA finally put out a warning on it, especially with a risk of infection and I assume skin necrosis. I also would be thinking from my critical care perspective, if somebody's doing it on somebody who is diabetic or maybe immunocompromised for whatever reason, their risk of infection and flesh-eating bacteria will be quite significant. So don't do that. If you feel like you have stubborn areas of fat, go see a surgeon who can actually give you all appropriate options for treatment. It's not always liposuction. Sometimes we can just help you to lose weight, but whatever it is, seek professional help.
One very popular fat dissolver a lot of you guys may have heard of is Kybella. Now, the thing is with a lot of these fat dissolvers, some of them are FDA approved, some of them are not. Some of them are only FDA approved for smaller portions of the body, not larger portions of the body. Like, it's very intricate and very specific. But nonetheless, I personally feel like you would definitely benefit more from going to the gym. And this is a very interesting and very very touchy topic for me, because if you guys have been watching me for a long time, you would know that I've always fluctuated in weight, okay? I've been diagnosed with ADHD binge eating disorder. So let me just lay it out, because I know there's gonna be people that ask who are new here. Shout outs to the new subscribers. I am diagnosed with bipolar disorder, generalized anxiety disorder, ADHD binge eating disorder, PTSD that comes and goes. Sometimes I don't even mention that because for what? And of course, depression. And I'm currently on a weight loss medication. I lost 20 pounds. Whoop, whoop to me. Shout out to those of you guys who follow me on Instagram and you've been following my weight loss journey or whatever. I am on semaglutide, and I know that's very, very controversial for a lot of people. I've actually been diagnosed with high cholesterol, and I am pre-diabetic. Diabetes runs on my dad's side of the family, and I am trying so hard to make sure I do not become a full-blown diabetic. It is literally my worst fear. Like, I am very, very active. I am a Zumba instructor. I'm in the gym like almost every day, and if I'm not in the gym, I'm taking a walk. I'm doing something to make sure I am active. I've done keto diets. I eat very, very clean. I'm super healthy. Like, I'm like one of those people, like, if anybody who knows me personally, or even if you guys been following me for years, you will know, like, I stay at the gym. I'm posting pictures in the gym. I'm always working out. I'm always sharing like the new protein this, the new supplement that I'm taking. Like, I'm very healthy. I'm just one of those people where it just really does take a lot for me to lose weight. Like, I've thought about doing cool sculpting, right? I've thought about this, I've thought about that, but when it comes to certain things like injecting something into me to dissolve fat, I don't think I'll do that. When it comes to weight loss medication, that's probably the furthest I'll go, and that's the furthest I've gone. Like, right now I'm on a weight loss medication. I've also been diagnosed with bipolar disorder, so I also take a medication that doubles as a weight loss medication, but that has never helped me lose weight, which kind of sucks. Shout out to those of you guys who are on Topamax, because y'all are, you know, losing weight and all of that, but it's never helped me lose weight. If anything, it's kept me very stagnant. Like, I've been the same weight forever until I got on semaglutide. That's when I started to lose weight. But, you know, being diagnosed with so many different things, I am on antidepressants. I'm on medication for my bipolar disorder, and I am on medication for my anxiety. However, my anxiety medication is as needed, and I've never been able to be on anything for my ADHD whatsoever. It's ridiculous as fuck. Like, I literally took a DNA test because I wanted to know what medications would work for me. Absolutely nothing works. From Adderall to Ritalin to long acting, fast acting, it just doesn't work for me. I'm just one of those people where my body does not react well to any of those medications. So I've just chalked it up to, like, I'm just gonna have to like take different types of things. I've tried so many different natural things. I will say lion's mane works pretty well for me, but it's just, yeah, I have a lot of things going on there. I talk more about my mental health on my personal channel. If you guys want to learn more about that, refer to that. But I will say, like, I've struggled a lot with my weight since I was a kid. Okay, I was super, super skinny. I was the heavier set kid. Into adulthood, I've struggled. I've hit my heaviest. I've hit my lowest. So I understand what it's like to feel like, oh my goodness, like, I'm never gonna lose this weight, or I'm never gonna gain weight. Like, I remember being in high school and feeling like, oh my God, like, I'm never gonna get these thighs, or I'm never gonna get whatever. Like, I've had, I guess, these body dysmorphic type of issues where, like, I was really skinny, but I felt like I was fat, or I was really fat, but I felt like I was smaller than, you know, I actually was, or like, you know, I was in denial about my body. Nonetheless, I will say one difference between me and most people is I've always tried to make a change. I've always tried to make a stride towards those things that I wanted. Every time I wanted to be thicker, I said, you know what, I'm gonna eat a little bit more. If I wanted to lose weight, I made sure I got my ass in the gym. I will say now that I'm like 29 and I'm about to hit 30, my dad, I believe, was diagnosed with diabetes in his early 30s. I was like, yeah, no, since I'm already pre-diabetic and I'm heavy for my height, I was 179 and I'm 4'11. I said, nah, what we're not gonna do is let me touch 180 and then I get heavier and then I get diagnosed as diabetic and all of that. Like, my blood sugar and all of that was already high as fuck. I said, we're not about to go into that territory, you know? Just to let you know, I stay in the doctor as well. I checked everything else is fine. Like, I don't got PCOS, my hormones, everything's great. It's just harder for me. So it's one of those things where you have to do what's best for you, but at the same time, we have to be very, very careful when it comes to injecting yourself with things that we don't know, and injecting yourself with things that are not legal in the countries that we reside in, and especially injecting ourselves with instruments that can potentially harm us, right? So the thing is with the Hyaluron pen, as we discussed prior in my lip injection video, is that it can genuinely cause more harm than good. So although the Hyaluron pen doesn't technically pierce your skin, it disperses whatever it is that is in it through your skin with pressure, without piercing your skin. This is why a lot of people feel comfortable going to these techs, because essentially they're not using a needle and you don't necessarily have to be a professional to use them. But the problem is it can essentially prompt you to have very uneven results, and it could cause bruising. It could cause all types of things that you genuinely do not want, because you can't control where the product is going. And on top of that, now we have people that are using these tools for different types of substances like fat dissolvers, and they're using them on your stomach, on your chin, on your back. And now you have like different doctors and professionals that are coming out and they're like, well, there's no real indication that this is really working, because like the skin on your thighs, on your fat, on your back, on your stomach or whatever, like they're thick. Okay, like it's one thing to use it on your lip, because like the skin on your lip is thin, but when you're using it on your stomach, when you're using it on like your chin and stuff like that, when you're using it on your back, like that's very thick skin. We have to think about like the fact that there's different layers on your skin, and it has to penetrate. Like there's no real way to tell that this stuff is actually penetrating your skin and going to where it needs to actually dissolve fat.
If a double chin bothers you, here's my opinion on what the best options are to treat it, and you're going to be surprised about why I say not to use Kybella. So does Kybella actually dissolve fat? Absolutely it does. It's an injection of a bile acid that dissolves the fat and then your body gets rid of it. The reason why it's not always the best option is not just because it's super expensive, gives you a lot of downtime, and still carries some of the same risks of surgery like nerve damage, but the main reason is that so many people that think they need Kybella are not good candidates, and they end up going to somebody who injects this into them and does not understand the anatomy properly. If you have a small bit of fat right under the skin, you might see a nice result, but most of us have multiple layers of fat, laxity in the muscle and skin, and if you get Kybella injected in that scenario, you're going to be one unhappy patient. If you're considering getting any kind of treatment for a double chin or what you perceive to be a double chin, I always recommend getting multiple opinions and seeing a plastic surgeon that operates on the face, so you at least know all of your options.
I'm just gonna make a video. I did try and respond to your comment, but there's more that I want to say. First of all, girl, run. Run, run, run. The Hyaluron pen as a device, first of all, is very dangerous. It basically uses pressure to shoot things through your tissue. And it works a little bit in the lips because that tissue is so fine and thin and fragile. I cannot imagine it working on like thick, dense skin. Even if it did, there is no precision when it comes to using a Hyaluron pen. It is just bursting it in and it's dispersing and going everywhere. So more than likely, your result will be very lumpy, very uneven, and will look worse than it was. The Hyaluron pen also can't reach layers of the skin that contain fat cells. And last but not least, an esthetician should not and legally cannot have access to chemicals like that. There's no way that she is getting those chemicals legally from a safe and reputable place. Please be careful.
Let me tell you all the truth about fat dissolving injections. Firstly, fat dissolving injections, it's not a weight loss treatment, guys. In actual fact, fat dissolving injections only really work when combined with a good diet and exercise. Also, you may be a really poor candidate for fat dissolving injections. For example, when we treat under the chin area for a double chin with fat dissolving, a lot of people think they have fat under here. It's actually just loose skin. In that case, you're better off looking at things like radio frequency to help tighten that area. If you go to the wrong practitioner, they may just charge you and do fat dissolving anyway. It's really important that after the treatment, you drink lots and lots and lots of water. This is gonna help flush out the fat. And if you're not prepared to do that, then girl, there is no point in you getting fat dissolving, I promise you. If you cannot commit to at least 20 minutes a day of exercise after your fat dissolving injections treatment, then again, girl, there's no point in you getting this. Regular movement is what's gonna help us, again, flush out that fat. So if you're not prepared to do it, don't even bother. One session, I guarantee, will not be enough. You're going to have to do multiple sessions of fat dissolving to see a result. Be careful because there are some illegal fat dissolving injections that are on the market. So make sure you're going to a practitioner who is licensed, is a professional, and knows what they're doing.
Now, of course, we've seen the results. Like, there's people out there that are actually getting results. But like, let's be real. Like, does that mean that every single person out there is going to get results? Of course, we already know the horror stories. Y'all ain't see the horror stories yet?
About the complications of fillers, but let's talk about the complications of fat dissolving injections. So I use all sorts of products, but I'm very passionate about the safety of use of these products. So aside from the fact that if you inject it into the wrong plane, you can cause dissolution of the fat sheath around nerves and can cause a nerve injury. But a lot of people don't realise that you can actually cause vascular adverse events from injecting fat dissolving products. So for example, here and here. So the name of the game is to try and keep this product out of the vessels. But obviously that's not always possible. Now the good news is that from reviewing these cases and from the other cases that I'm aware of that I've been having discussions about, the damage doesn't seem to be as significant as when a dermal filler is injected into a vessel. But these present and look a little different to dermal filler vascular events, and the mechanism of action is also slightly different.
So for those of you guys who are skittish and don't want to see anything graphic, please just skip right here because I can't even look at any more pictures after this. And if you're interested in any of the stories that I post on the screen, they will be linked down below for you. But I just have to put these on the screen because some of you guys know about to do it, all right? Y'all don't listen. Y'all hard-headed as hell. Y'all need to see what's happening to a lot of these people that go through with these procedures through unlicensed means, who are getting these things illegally, because this is not okay. So here's the timestamp if you want to skip through it because it is graphic. The bruises that people are coming out with from getting these fat dissolvers are crazy. Okay, people are out here getting all types of maimed, injured from getting fat dissolvers, especially with Hyaluron pens, especially from people who are not licensed to do so. Understand, if someone is offering that service, they have to at least be some sort of medical professional like an RN. Okay, they cannot just be out here dissolving fat at the back of a tire shop. Okay, that's not how this works. This is extremely problematic, and I really don't want anyone to come away from this thinking like, damn, like I'm never gonna lose weight. There's nothing I could do. There's so many things that you can do. And I feel like when it comes to a lot of us, y'all, we are lazy as hell. And I can even say, as much as I go to the gym, as much as I eat right, as much as I get lazy sometimes. There's so many things I'm just like, oh, I just don't feel like it today. Like I don't feel like lifting this weight. I don't feel like teaching this class. I don't feel like, you know, whatever. Like, even though I'm a dance teacher and I'm a Zumba instructor and I go to the gym, like there's some days I wake up and I'm like, I just don't feel like doing it this week. Okay, you know, like I get it. But when you're gonna do something, you have to be committed to it for your life. It's one thing to be lazy for the day or even the week, but like you have to commit to it. If you truly want to lose weight, if you clearly want a new body, if you clearly want a different lifestyle, if you don't want to be huffing and puffing when you come up the stairs, if you truly want to add extra years to your life, if you don't want to be on a certain type of medication for the rest of your life, if you don't want high blood pressure, if you don't want this, you don't want that, you really need to do a lifestyle change. That's what people don't understand. It's not necessarily about, oh, let me work out to look good to get a fat ass. And I think that's what a lot of people don't understand. What's not clicking for a lot of people. What a lot of people really want is, oh, I want a fat ass. I want a small waist. I want this. I just want to look good. It's not about looking good. It's supposed to be for your overall wellness. You shouldn't want to go to the gym and eat right and all of that just for vanity's sake. You should want to do what's best for you because that's what's best for you. You should want to nourish your body because that's your body. Who wants to walk around feeling groggy, feeling like shit, looking like shit, all the time for the comfort of eating donuts, pizza, and fast food all the time. Like, that's honestly why I started working out all the time and literally started to make better choices when it came to food, because I really just hated feeling like shit. It wasn't about the aesthetic of looking nice and being cute in clothes and all of that. It was the fact that I didn't want to keep feeling like shit. Okay, like I was tired of being backed up all the time. I was tired of like waking up and wanting to go back to sleep. That's really what it's all about. It's the fact that like a lot of us, you know, have kids in our lives, or we have children that we have to take care of, or we have family members and we want to see them longer, whatever the case may be. Whatever it is that your goal is, it shouldn't be, oh, I just want to have a fatter ass, or I just wanted this, I wanted that, or I want to have better skin. It should be, I want to have a better life. You know, I want longevity of this life, you know, and nothing is going to make you necessarily do that unless it's you and it's for a genuine purpose. That's why it's so hard for a lot of people to actually stay on track when they commit to eating right or going to the gym or taking a walk, like literally, because it's like, what is your real reason? Because if your reason is, oh, I just want to look good, you're not going to do it. So with that being said, when it comes to all of these situations, from filler to plastic surgery to Hyaluron pen bullshit and all of these other crazy things, people are only doing them for the temporary satisfaction of not having to do the work. That's really what it is. A lot of people don't want to do the work. A lot of people want that satisfaction of, oh, one, done, don't gotta do the work. One, done, I don't have to look at this again. It's a temporary fix. I got my ass done, got my boobs done, got this BBL, got this filler. I look good. That's all that matters. No one's thinking about the longevity. Nobody's thinking about their health. Nobody's thinking about the professionalism. Nobody's thinking about the legal ramifications of any of this. Everyone that does these things is just looking for the easy way out and the gratification of things. And that's what's leading everyone into these issues. A lot of people need to understand that getting into these problems and getting into these issues is what's going to lead you down a dark path. With that being said, I would love to hear your thoughts and opinions down below. Have you seen anyone offering these services? Did you do any of these services? Would you do any of these services? Why or why not? I would love to definitely touch on the cool sculpting situation next, because I'm finding out that apparently there's stuff behind that too, because it's crazy. I actually know a couple people that offer that, and now I'm like, oh, I might have to, I'm not gonna say nothing because it is what it is. But apparently, yeah, you can't just be out here cool sculpting people either. So stay tuned for that. Thank you guys so much for supporting me. Again, if you are in the tri-state area, make sure you pull up to my speed networking event. I can't wait to see y'all there. Everything you need is going to be linked down below. Make sure you guys get your early bird tickets because they're not going to be here forever. They're only $40 and food is included with your ticket. There will be a cash bar. I love y'all so very much. Follow me on Instagram and I'm going to see y'all next time. Bye.